Hello and good evening. Welcome to CHD Wise, an education series for patients and families. My name is Rebecca Acosta, and I am the Education Coordinator here at Conquering CHD. Tonight's topic of discussion is COVID-19 and CHD, and will be presented in a town hall format. It is being recorded and will be available for viewing at conqueringchd.org as early as Thursday. All participants are now muted and can submit questions using the Q&A chat feature at the bottom of your Zoom screen menu. Thank you to our generous sponsor, Medtronic, for sponsoring today's town hall. Today's event will be moderated by David Kasnick, Executive Director, and Amy Baskin, Director of Programs, both from Conquering CHD. Our physician panel includes Dr. Nicolas Madsen, an inpatient cardiologist at Cincinnati Children's Hospital, as well as the immediate past chair of our Medical Advisory Board, Dr. Matt Oster, a cardiologist with the CDC's National Center on Birth Defects and Developmental Disabilities, and Dr. Subramanyan, a cardiothoracic surgeon at Children's Hospital Los Angeles and the current vice chair of our Medical Advisory Board. Dr. Michelle Gervitz is on service tonight and was unable to join the presentation. On behalf of the staff and volunteers at Conquering CHD, thank you so much for joining us today. Before we get started with the town hall, I will turn it over to Amy Baskin, who has preliminary information to share from Conquering CHD's COVID-19 and CHD research survey. Amy?
Good evening, everyone. I have the privilege of giving you just a little bit of information before we get to the question and answer portion of our evening from the survey that we have shared with all of you publicly, both through email and through social media. And I wanted to thank everyone who's already engaged with the survey, whether you've taken it yourself or you've had the opportunity to share it with those in your circles. It's made a huge difference. So far, we've had over 500 people interact with the survey, and 204 have brought it to completion. And of those 204, 28 have self-reported that they have symptoms of COVID. Then we asked additional questions about testing, and 17 folks have already undergone testing for COVID, 14 of which were negative, 2 were positive, and 1 was still waiting for results as of June 11th when the survey, when we did our last round of survey data pulling. Then we asked, in addition, about antibody testing, since that's becoming increasingly available. 7 folks who completed the survey had already undergone antibody testing, 4 of which were negative, 1 positive, and 2 waiting on results. So I encourage you all to continue to share the information about the survey. You can find it both on our website at conqueringchd.org or through our social media platforms, because as we increase the number of people who complete the survey, we can then start digging deeper into the data and provide you more information about what we're seeing for those who are reporting that they're having symptoms or that they've completed COVID testing. So I just wanted to give you that update, and now we can move on to the questions. I'm very excited to start. Oh, sorry.
I was just going to say thank you so much, Amy. Over 200 questions were submitted in response to today's town hall, both through email and social media. There were several themes, and I've compiled the top 9 questions which will be addressed by our physician panel this evening. Of course, the experts will not be able to answer every question that we have that was submitted, and they will not be able to answer questions regarding your specific care or treatment. So now I'll turn it over to Amy and David, and I'm going to stop sharing my screen, and they are going to moderate our lovely panel.
Excellent. Well, I am so thrilled that all 3 of you that were able to join us are leaders in the community, as well as excellent champions on our Medical Advisory Board. So thank you for taking the time out to be with us tonight. As Rebecca mentioned, we're going to start with some questions that we gleaned from the general community. And for those of you who don't feel that your question has been answered, please don't forget to submit a question through the Q&A box. All right, here we go. We're going to start with Dr. Subramanyan. One question, or our first question, is about the heart muscle. How does COVID-19 affect the heart muscle specifically? Does it affect hearts with CHD any differently?
Thank you, Amy. That's a very good question. Right now, there are no data to suggest that COVID-19 impacts heart muscle in any specific way, or that it impacts heart muscle in any different way than other viruses that we know of. It seems to primarily be a respiratory illness. Having said that, the number of children with congenital heart disease who also turned out to be COVID positive is small. So I want to warn you that we're in the early stages of collecting data.
Anyone else want to chime in?
No, I think you answered it great.
All right. So moving on, our second question. How many positive COVID cases in patients with CHD are you aware of? Matt, I'm going to tap into you with your CDC knowledge and see if you can give us a good answer to that.
Sure. So good evening, everyone. I'm Matt Oster, pediatric cardiologist. Some of you know that I work in Atlanta at the Children's Healthcare Atlanta, but I also work at the CDC, and I've been helping them on the COVID-19 response. So tonight, I'm coming to you as a CDC rep, sharing with you some of the work we've done. So this question about COVID-19 and CHD. So in April, I worked with the one of the task force that was really looking at risk factors, and I was very interested in working with that group because of my concern of kids with congenital heart disease and how they would be affected by this. And I was pleasantly surprised at how little work there was for me to do with regards to congenital heart disease in April, because this wasn't really affecting at least kids with congenital heart disease that much. There was one big study that CDC published looking at children, showing that the numbers overall were really small. And then when they looked at how many of those, had heart disease, that was even really small. And when we tried to get into the details of what people were saying, it was hard to really find any common themes about certain types of heart defects. There was a study that came out looking at kids in intensive care units with COVID-19 and looking at risk factors or certain common underlying conditions. And congenital heart disease was in a few of the kids, but out of about 40-something kids, only about 3 of them had congenital heart disease. So it was still really, really small numbers. The biggest risk factor was really having severe respiratory problems. Many kids who were trach dependent had a very difficult time with this, with the acute COVID infection. So like Ram said, the biggest issue seems to be having bad lung disease, and which some of our kids with congenital heart disease can have, but just having congenital heart disease itself doesn't seem to be a major risk factor. Although if you look at the CDC website, it'll still list congenital heart disease as one of the conditions that may be a risk factor, just because, as we said, we're still early on learning a bunch of this. But fortunately, our kids, at least, with congenital heart disease have been spared. We did at our hospital a case series with a group of other hospitals, just trying to identify other kids and with congenital heart disease who were affected. Seems to be amongst the congenital heart disease group, really the younger ones who might, like under a year, who may be at small increased risk, but you're already starting at a really low risk. Plus, again, the ones with bad underlying lung condition. So that's all regarding the severe, risk of having severe disease from having acute infection. I know a lot of people are worried about this new syndrome, the MIS-C, multi-system inflammatory syndrome in children. I can tell you that we've been looking at that many different ways, both at data here in the United States and abroad, looking at potential risk factors. To date, we have not identified anything really specific. So congenital heart disease for that at least has not really been identified as a specific risk factor. A couple of cases of kids with congenital heart disease, but nothing beyond what you would expect just overall for the baseline population. So stay tuned. Again, everything's early, but I think the good news is that it seems like for the most part, kids, at least in the children with congenital heart disease, don't seem to be at a greater, significantly greater at least, risk of having severe effects from this disease.
Great. So just to elaborate that on a little bit, are CHD patients then considered in the high risk for serious illness category as is included on the CDC website?
Yeah, so as I said, if you go to the website, you'll see that they are in the conditions that may be at risk. There's a lot of hand waving there. It's based on the history that we know of kids who can get respiratory viruses like influenza or RSV or other things. And so since there's still so few cases, it's hard to say that they're truly and significantly at risk. But again, in children in general, at least, the risk is already very, very low of having severe disease. So any increased risk still has you in the overall low category. Not zero risk. It's not zero risk for any heart healthy kid. But fortunately, it's been fairly low.
Thank you. Unfortunately, Michelle, Dr. Gervitz wasn't able to be with us today. Do any of you feel comfortable commenting on the adult congenital population as an adult with CHD? Are they considered in the high risk category?
You know, I'd say it kind of goes back to some of the other underlying conditions that a lot of our patients, even adults with congenital heart disease, have other effects of that. So especially adults with CHD who have poor lung function, who have poorly controlled heart failure. Those people certainly, I would think, fall into the higher risk category. A person who has congenital heart disease who is doing fairly well and doesn't have those side effects, I would say we have too little data to really say that they're increased risk.
Great, thank you. Anyone else want to comment? All right, Dr. Madsen, how do you explain to youth and teen patients that their heart disease is different than the heart diseases they're hearing about on TV who are being impacted by COVID-19?
Yeah, thanks, Amy. Greetings, everyone. I think the question here is, it's interesting when listening to this question, it's, how do you explain to teens? How do you explain to adults? Sorry about the dog. How do you explain to teens that their heart disease is different than the traditional risk factor that we're hearing about in the media in terms of cardiovascular disease? I actually think, I don't know, this may be just my opinion, but in many ways, this is the same explanation I would give to the adults of those teenagers or anything, I guess, school age and above. Fundamentally, the disease process or condition related to congenital heart disease is obviously different than acquired cardiovascular disease that comes with risk factors like smoking and obesity and hypertension and diabetes and simply age. And so, in the teenage population and younger, I would just stress that there is a fundamental difference between a aged heart that has been exposed to risk factors associated with lifestyle and the heart of a child or adolescent who was born with congenital heart disease. As Ron mentioned earlier, we don't know of any particular risk specific to the heart related to COVID that goes beyond what we see with other viruses. And so, I would caution, my patients and the families of my patients that that this is really not so atypical relative to some of the viruses that we see that we, I think, take for more the part of the season that we're in, be it RSV or flu, as was already mentioned. So again, I think that the answer for this comes back to, I would provide the same explanation I would provide to the adults of those patients and maybe the younger siblings of those patients, that when you're hearing about cardiovascular disease in the news, what they're talking about is cardiovascular disease that is acquired with time and risk factors, and that is fundamentally different than the congenital heart disease, which is found in this case in otherwise young and healthy individuals.
This question is for all of you. What should families consider before sending their children back to daycare, camp, school, all those? I think it's probably the most common question we've been getting is what should we consider before we do this? So I don't know who wants to go first. Dr. Oster, do you want to start?
Yes, I'll tell you what I've been telling my families in clinic who ask me this question. And I tell them for their child with heart disease, I would follow pretty much the same guidelines that they would follow for their child who's heart healthy, right? So clearly we're not out of the woods yet, regarding this virus. It is still prevalent in the communities. It is still affecting many individuals, and a few states I saw today had their highest case counts throughout this whole pandemic. So we still have a long way to go. So I would say, if, for your own child, the current recommendations still are practice safe social distancing, have good hand washing, wear a mask when you're out. I think all of those still apply to all individuals, not just those with congenital heart disease. And so the guidelines are out there. There's enough information out there. And so I think now it becomes like anything in medicine, and, our role is to provide the best advice we can and what the information is, but it's still up to families to decide what's right for their family. Because different families can have different thresholds, trying to balance what works for keeping their family healthy, yet also keeping their family productive and getting the care that they need. And I think that comes down to an individual decision at the end of the day.
Great, thank you. Dr. Subramanyan, do you want to chime in?
No, I think that was very well answered. That's what we've been telling people here. We would follow the same precautions and guidelines we would for their heart healthy kids.
Great, and Dr. Madsen, anything to add?
Yeah, I think the only thing sometimes worse than risk is not knowing, right? It would be much easier if we could wrap our minds around what exactly the risk is, and to a T. And there was a question earlier I saw about when will we have enough data? Probably not for a while. And so we have to go with what we know so far. I think what makes this difficult is the newness of it, the fact that we're not dealing with it last year at this time, and very few things in our life have this type of impact that are so new and so unknown. But I would counsel all of you that have either children that with congenital heart disease who are teenagers, or you have other children who are teenagers, is at some point you put those teenagers behind the wheel of a car, and you decided that the benefits of doing that outweighed the risks of doing that, despite the fact that every year about 300,000 teenagers go to the emergency room because of something motor vehicle accident associated. And so that is a huge risk. And we take it on because we think there are benefits to it. Now, I'm not trying to draw a one-to-one comparison between that and COVID, but it's just to say that we make a lot of decisions every day about risk. What makes COVID, I think, additionally uncomfortable is that it's so new. But exactly as Matt mentioned earlier, so far, the indications are that the risk is not unusual or exceptional in our congenital heart disease population. Now, that's not the same as me telling one family to choose daycare or not choose daycare, but it is to say that we take on risk every day. And so in so doing, you have to make the decision that is right for your family. And that may be relative to how you feel about risk, or relative to, if you don't send your child to daycare, you won't get to keep your job. And there is certainly known risk associated with that.
And
excellent answer, thank you. Oh.
I would add to one thing that, Nicholas brought up, the question regarding when are we gonna have data? Why don't we have the data yet? And I know it's frustrating not to have the data. And I kind of look at it from the other angle, like for the congenital heart disease community, it's kind of a good thing that we don't have the data yet, because if we had a lot of data, it would mean there are a lot of people who are sick. And we don't know a lot of the risk because a lot of people aren't getting sick. And it's a lot harder to say that someone's not at risk than it is to say that someone is truly at risk. It's like, we know that the older population, lots of cases of that, definitely at risk. We know those with really significant underlying lung disease, lots of cases of that, very much at risk. We just haven't seen that many cases of people with congenital heart disease. And so we don't really want to say zero risk, because there is no zero. But we want to just build upon our past experience with other respiratory viruses to know that, there's always some risk, but fortunately it hasn't, been nearly as bad as we thought it would be. I think all of us thought that it would affect our congenital heart disease community a lot more than it has to date.
Mm-hmm. Well, thank you all for, oh, go ahead.
No, but I was going to say, building on that too, I said it hasn't affected the community. I mean to say from an infection standpoint. I do believe that this has affected our community a whole lot more from the quarantine, lack of school, lack of socialization, lack of getting therapies, missed visits, missed, procedures. I think that's affected our community a whole lot more than the actual infection thus far.
Excellent. Thank you. I appreciate the reassurance from all of you as a parent. The last one dovetails, Matt, or Dr. Oster, on what you were saying. How do I advocate for routine appointments, dental well visits, etc., if the care provider is not accepting patients right now due to the coronavirus?
Yeah, I saw that question, and that saddened me to see that that's a problem for the community. I mean, I know that many places are figuring out their logistics for opening. Different clinics have opened at different levels, not just cardiology clinics, but dental and pediatrics and specialties and therapies and other things of that nature. So, I think there is guidance online for how to open and how to follow and what procedures you can follow. But I think there's a part on both the clinic's part and the family's part to make sure that everyone is safe, because, I think those clinics or providers are trying to protect their other patients. They don't want people bringing stuff in, but they're also trying to protect you, not exposing you to something they don't have. But I do think, as I mentioned, as I said, I worry about the term that's often used at CDC is collateral damage from this virus. That what are the unintended consequences of people not getting the care that they need and not getting the socialization or the schooling or the therapies. And that's a real worry. And I hope that will get better over time, because I think we've shown that with proper measures, with the face masks in clinical environments, with good hand washing, with good sanitization, with minimizing the number of people who need to be there, that yes, we can treat people in a healthy manner and in a safe manner.
Excellent. Anyone else want to comment?
Sure. I'll handle the elective surgery aspect of it, Amy, because that question has come up as well. We had a meeting amongst the surgeons who are caring for children with congenital heart disease, and both as a surgical community and as part of a children's hospital system or a system that provides care for pediatric patients, I think when it comes to elective surgeries, we are still screening all the children for COVID-19 infection prior to elective surgery. And if they are positive, and even if they are asymptomatic, the current recommendation is not to proceed with elective surgery, certainly elective cardiac surgery. We're waiting. I'll give you a classic example. Someone who needs a pulmonary valve replaced because they've had a previous truncus or a previous tetralogy repair. This is the summer. Most people who are in school like to get those done before school reopens. If they're asymptomatic COVID-19 positive, this is considered an elective operation, and current recommendation is to wait A, if the symptoms go away in case they have symptoms, and B, 6 weeks since positivity. Now, I hate to say that there are no data, but there are no good data to say 6 weeks, but that seems to be a good number for other viral infections. So we are following those for elective surgical procedures and not moving ahead with them. But other than that, like Matt said, we're providing, routine surgical follow-up, et cetera, and most centers are as well.
Great, thank you. So this concludes, that's the last question that I have based on our social media survey or question submission. There were several questions related to adult congenital care. So we'll work with Dr. Gervitz to help address those specifically and provide some responses to those to assist our ACHD folks as well. But now I would like to turn it over to David Kastnick, who is going to work through some of the questions you've submitted right now today through the Q&A process.
Great, thanks Amy. Thanks everybody for joining us on the call. Nicholas, Ram, Matt, thank you again. This has been great so far. I think we have some really good questions that I'll go through. And this first one, I'm gonna dig a little bit deeper because I think people wanna know maybe a little more data on the data. If I can say that, and maybe I'll start with Ram and then go to Nicholas and then Matt. So somebody asked, what is considered enough data? When do you estimate that time point will be reached? Maybe another way to say it is, when do you think the threshold of enough data will be reached as well? Ram?
That's a very good question. And really, like Nicholas said, I don't anticipate that to happen anytime soon. This is a new disease. We're trying to understand this. I think we're going to learn every day. We've all seen this. Our local and national government's response has also changed on a week-to-week basis because we're all learning from this. I anticipate that by the end of this year, by calendar year, we'll probably know a little bit more about how it spreads and under the usual winter conditions and so forth. But to be able to fully understand the impact of this virus is probably going to take several more months, if not more than a year. I don't mean to sound diffident. I just want to be honest.
Thanks, Ram. Nicholas?
Yeah, agree completely. I think while frustrating in terms of the unknown, we actually know a great deal about a condition that nobody had ever talked about before February. And so, if you think about in 4 or 5 months, how much we've come to understand about this condition is, a testament to all the people that are working very hard on better describing it on a, on really all levels. And so, I think to dovetail with what Matt said earlier, I think we certainly know more now than we did in March. And I think are increasingly comfortable in saying that while there is no such thing as zero risk, there does appear to be less risk in the pediatric population, and that minus those with very specific risk factors, that the rest of the pediatric population with chronic disease, be it congenital heart disease or other, is mostly in the same category as their siblings. There won't be a magic moment, I don't think, because then we'll be learning more about the vaccines and we'll be understanding how the vaccines work. And, I brace for the day that we have a vaccine, but, the vaccine is not 100% effective. And so how do we manage that? And it will for sure be a moving target over time. And so it won't be perfect. We will have to lean on each other and our community, and be it other parents, and certainly our clinicians and our teammates, so to speak.
Matt, do you have anything to add to that?
No, I think those were very well said. We've touched on the data issue, and when I talk to families about their kids, I tell them I'm honestly worried more about the parents and grandparents of kids with congenital heart disease right now than I am about the kids with congenital heart disease from this virus specifically. So we need to remember that there's a lot more vulnerable than just the kids with congenital heart disease And I want to make sure though the kids, the people with congenital heart disease are getting the care they need and not trying to stay away from the hospital because they're worried about this. We've had people not go to the emergency room because they're worried about being exposed and have deferred care. That's not a good thing. People who are not getting their vaccines because they're worried to go to the pediatrician's office. That's again, not a good thing. I think we know enough, at least about those parts, that it's safe to get the care that you need. And so definitely do those activities. And yet keeping in mind that there's still more to learn as we go along.
So Matt, that's a great segue to another question that somebody had about the lack of data. Could the lack of data be due to CHD patients and families staying home or not being in the system to get more feedback or data on those patients? What's your thoughts?
Well, I certainly can't tell you those who are staying home what is the asymptomatic prevalence of COVID in those kids, right? Because we know that many kids do not have symptoms, and so they're not getting tested. And yes, I think it's a safe assumption to say that there are many children with congenital heart disease who have gotten COVID who have had no symptoms and didn't get tested. I think we can reasonably say that. So if you're looking at what's the actual total number of kids with congenital heart disease who have had COVID, yes, I think staying home makes it impossible for us to know that number, and that's okay. We don't need people going to the hospital if they don't have symptoms. I'd rather them be safe than get an actual number in a chart. But in terms of how many kids have been severely affected by this, I think those kids are seeking care eventually, and we are getting information on those kids. And I don't think the failure to or the reticence to seek care is affecting our understanding of that in the bigger picture.
So Matt, can I just build on that? So social distancing, I think, is something that the community is proud of doing because we have done this before when our kids have been ill or post-surgery. So is that also then affecting exposure rates, and or are you saying that we really don't know because of the asymptomatic nature?
That's an excellent question, and I don't know that. I don't know whether those who were felt to be in the higher risk groups from the beginning were purposely avoiding contracting it. If so, then great, because I'm just happy with the end result that we don't see many kids with congenital heart disease getting this. That being said, we do still see, every year, and this year was no exception, a large number of kids with congenital heart disease get influenza and RSV and other things despite parents' best efforts. But yes, maybe people ramp those efforts up during this pandemic. So yes, that's a tough question to ask. So I would say what people have been doing, at least for congenital heart disease community, is working. But I would echo what I said earlier, that we are not out of this yet. All right. So I would not, change a whole lot of what people have been doing over the last couple of months just because we think we're over the hump.
Amy, that's a nice segue for me to add a little asymptomatic numbers that we've looked at. So again, I think credit goes to the parents, and somebody has it in the Q&A now, that parents are very good. CHD parents are very good at keeping their kids from getting any infection, and COVID isn't an exception to that rule. So that's great. Another positive trend that I want to put to what Dr. Oster just said is surgery for congenital heart disease is resumed in most institutions. And a significant proportion of institutions is screening everybody that comes in for any elective surgery. So this is one avenue where we've been able to look at asymptomatic COVID infections. And based on the data we have, none of which has been published or official yet, there does not seem to be a very large proportion of, or a disproportionate number of CHD patients that have asymptomatic COVID than what we've seen in the population. This is, to me, again, another nice positive sign. And I say this as a kudos and as I clap my hands to all the parents and families who have done a terrific job taking care of their CHD children. And so that should answer one more question that's in the Q&A. We still need to be careful. We still need masks. We still need hand washing. We still need to be physically distanced. We still need to be careful to make sure that we don't unnecessarily expose ourselves to any more infection than we absolutely have to. But so far, we've been doing a good job.
So Ram and maybe Nick, I'm going to dovetail into that mask conversation real quick because somebody's asking us to talk about mask wearing. Why are we hearing so many different opinions on this? And who do we listen to? Who do we believe? What is the standard of care? What should we be thinking as patients and families?
I will answer that in one line before I think I'll pass it over to Dr. Madsen. You cannot be too careful. And I think there are some data, the strongest data come in when you are in an environment where continuous social distancing of 6 feet may not be possible. Classic examples are when you are in a clinic to visit a physician for a required care, when you're in the supermarket, when you are, say, in a group area. There appears to be good evidence to suggest that masks help under these circumstances. And therefore, I personally follow it. And so I would recommend that we continue to follow the mask guidelines, particularly when we are in a community setting. Dr. Madsen.
The example I like to give, and this is borrowed from what I used to say when it was more controversial to recommend a vaccine, was that if everyone is following the rules of a traffic light, then you could easily pull up to a traffic light, see that nobody is coming, and drive across the traffic light if it's red. And you will be just fine. And if you have, your wits about you, you will probably avoid every accident. However, your neighbor notices you've been doing that for a while and they take on the same practice. And then pretty soon their neighbor takes on the same practice. And pretty soon, when you get to that traffic light that you used to roll through the red light, you have a significant problem. I find that example is helpful when talking to people about why it's important to wear masks. For sure, if 1 out of 100 people is not wearing masks, then 99 people are protecting that one individual. And they can feel very brave and cavalier in their approach. However, as soon as the majority and the vast majority stop wearing masks, you have the problem of this, traffic intersection. And so I would try to put it in those terms, that it's safe to run a red light when you're the only one. It's safe to not wear a mask when you're the only one. But since we all interact with each other and we seem to be able to follow the rules of the road, maybe we could follow the rules of social distancing and wearing masks and the like.
Matt, you have anything to add to that?
Yeah, no, I think that was very well said. It definitely concerns me when I see how many people are not wearing masks but are out and about. The masks protect not only the wearer, but more importantly, everyone around them. And so when you go out, yes, you should be wearing masks, and you should be hopefully frequenting places where people who are there are also wearing masks. They're protecting you. As I said, our numbers here in this country, while they're lower than they were a month ago, they have not come down nearly as sharply as some other countries that implemented pretty strict mask wearing. So it's definitely a concern. It's definitely a worry. How will this go? We don't know. I just know, though, for my family, when we're out, we are all wearing masks, and we're trying to avoid places where we think that others are not being as adherent to those policies.
The other argument I would make to those who are resistant in your families to wearing masks is that if they really dislike masks so much, then wear them for the next 2 months and see if that doesn't have an impact. And then we can talk about not wearing them in 2 months or to reconsider it. The fact that they are not wearing it inconsistent now means that we will be talking to them about masks for the next many, many months to come.
You read my mind, because that was the next question on my list, Nicholas. So educating other family members or grandparents on why it should be worn, I think that's a great answer, just saying, let's just see what the data is in a couple months. It's not I understand the freedom issue, but I also understand you're protecting somebody that you really love and care about. And that for me as a parent is what I want to tell my family. And this isn't about you. This is about my daughter and protecting her right now, because we don't know. We don't know. And is it going to really be that big of a deal to wear a mask? And when you get to that heart of the matter, no pun intended, but of why we're all here and why we're doing this, it's about our patients and families and the people that we love. And that's, I'm just giving my own opinion on how you can educate your other family members. Is it's not about them, it's about the people that are most at risk. Sorry, I'm not supposed to be answering these questions, but
I think you did a great job there, David.
Okay, thanks everybody. I'm going to the next one. This one's a little more detailed when it gets to the medical side. So somebody's asking, would you say that COVID-19 or MIS-C are more of a concern than seasonal flu or RSV? Ron, you want to tackle that first?
Sure. I'm trying to understand what the crux of the question is. Is the question with respect to severity, or is the question with respect to infectivity? So I'll sort of give a very general answer. Yeah. I think a viral infection is a viral infection. Prevention is the best form of cure. So especially because COVID is less well understood as a virus, I would say we take the best precautions we can, which goes back to what we just said. Hand washing, masks, intelligent physical distancing, and doing all the right things to protect our children. I think that's a generic answer, but I think that's the focus of this question, if I'm understanding it correctly. So I would say, no, there's no reason for me to think that this viral infection is any different than others, other than the fact that it's the newest one. So I would be just as careful. Hopefully that answers the question.
Matt or Nicholas, anything to add?
You know, it's a hard question to answer. I hate to pit diseases or conditions against each other, especially since they affect different people different ways. I think we need to take all of these seriously and still all do our part in this pandemic, because, you know, as I mentioned, while this webinar is focused on the children or adults with congenital heart disease, who we're all certainly worried about, we all have other family members for whom this might affect even more, who, whether they're elderly or they have other underlying conditions or are on immunocompromising medicines. So I think, you know, this, virus, while fortunately it's not affecting at least children with congenital heart disease as much as, say, influenza or RSV, it's still very important and prevalent in the community. And it's an important public health thing for us to all address.
Anything to add, Nicholas?
No, that sounds good.
So the next one, I think I know where you guys are going to go, but I'll ask it. On the different populations in the CHD community, which are specifically high risk by nature, single ventricle, transplant, interstage, are they at more risk because of their specific condition, especially when you talk like a transplant being compromised from an immunity standpoint? So what do you all think about that, or is the answer we don't know?
Well, if you're going to give me a cop out and I can say we don't know, then I'll go with that. But I would say, if you're going to look at things, it's certainly anyone who is immunocompromised for any reason, whether that's from an underlying condition or because of medicines that they're taking, I'm a little bit more worried about than your person in a similar situation who's not immunocompromised. And that goes, but the transplant community, you talk about the CHD community, trying to keep their kids healthy and safe. Transplant community, that is every single day for them, not just flu season, not just RSV season. That's living the life. So hopefully they're taking the proper precautions. In this, for the single ventricle population, as I said, no two single ventricles in my mind are the same. We try to come up with guidelines for all of them, but they all have different you know, things that are affecting them in life. And I would say the ones though that are more severely affected, specifically with lung issues and, you know, poorly controlled heart failure, I'm more worried about those than the kid who I'm just seeing once a year who's, you know, going to school and having fun on the playground, doing okay.
Nicholas Rom, anything to add to that?
Yeah, I think this is, you know, part of what makes congenital heart disease a challenging, obviously very rewarding, but still challenging area of medicine with which to work is the fact that it's a very heterogeneous population. There are many, many types of congenital heart disease. There are many resultant lives that are in the community of congenital heart disease. And so it is hard to come up with blanket statements. It is a little bit simpler in the cystic fibrosis community, not to suggest that that is any less of a worry, but that it's more of a one type or a few types of populations. And so what makes a lot of this recommendation really hard is, and this is when the question that was brought up earlier is, when will we have enough data? Because I'd like to set that date on my calendar. We may have more data that pertains to the VSDs or the tetralogy of Fallot patients before we have more data on the single ventricle, before we have more data on the adult Fontans, before we have more data on the pulmonary hypertensive patients, before we have more data on the transplant patients. And that is what makes the recommendation so challenging, and it's not a very satisfying answer, and so I apologize for that. And then the mix of that is that we live in different communities. You know, Ram and Matt and I live in different cities who've had different experiences with COVID, and a lot of schools and how schools open up is being determined at the district level. So you could even look at a state like Ohio and say, well, the Cincinnati school district is doing something different than the Columbus school district, who's doing something different than the Cleveland school district. And so that's a lot of mixing of different variables and trying to figure out what is best. I think we can still fall back on the fact that in all of that population, Matt, Ram, and all of our colleagues are seeing very, very little congenital heart disease in the hospital, thank goodness. And yes, that is obviously because the community is putting forward its best effort, because we've gone through some very stringent rules and regulations. But I still think that it's been long enough now that we have a little bit of confidence in saying that the risk factor does not appear to be astronomical. But again, I think, to go back to the origins of the question, it is hard to answer those particular questions. And you know, I, like all of the clinicians that you all interact with, have received a lot of questions, and I haven't just sent back a boilerplate answer because there are some patients, some families where I've given a little bit slightly different response. And exactly as Ram and Matt have mentioned, a lot of that has been based on what is their lung health. And that is probably a slightly different category, though still not of the risk that we associate with grandma and grandpa, which is entirely different.
Okay, Ram, anything to add to that?
No, I think I most agree with especially the last point that Dr. Madsen just made. Some of the questions that showed up there ask about pulmonary hypertension, someone that's desaturated, someone who's a Fontan. I view it, like Nicholas was saying, more from a lung health standpoint. Who will a pneumonia or a pneumonitis or an infectious process in the lung, who will have a worse clinical picture if this were to happen? Those are the people we get most nervous about and tend to be more conservative in recommending to them. I'll give you an example that happened in our clinic last week. We had a 7-year-old who had a VSD closed when he was an infant, and an 8-year-old who was a Fontan, otherwise doing well. They both had the same question, and like Nicholas just said, the recommendation is not boilerplate to both of them. So it's a little bit of what the underlying lung health is and what pulmonary circulation, what lung physiology will do if there was inflammation from the virus. And then it's not unique to COVID in any way. We do the same with RSV. We do the same with any other infection. So this is not to pit one disease against another. This is just to give a framework within which we can intelligently risk stratify our children.
Great. So last question here is we have about 7 minutes left. Somebody's asking about COVID and a vaccine. So they're asking about safety and when it would be appropriate to give a CHD patient a COVID vaccine. I know we're early on the vaccine talk, but any thoughts on timing? Would it be the same as other vaccines when you give a CHD patient? Any thoughts on a vaccine in CHD patients? Matt, you want to start?
Yeah, so this has come up a lot in the last month, especially with all of the stuff with MISC, the multisystem inflammatory syndrome in children. And I would say that concern is not unfounded. That if we think that this syndrome is a post-inflammatory antibody-mediated syndrome and we're still learning more about it, then that raises the logical question of, well, if that syndrome is caused by an antibody response or your immune response, and the whole point of a vaccine is to induce some sort of immune response, then can you potentially have that happen? And I'll use your answer from earlier, David. We don't know. We're not sure. But I can promise you that people are sounding the alarm and are well aware of this, and that any vaccine will hopefully, be rigorously tested, before, it's hopefully unleashed. There's a lot of factors that go into that, some of which are scientific, some of which are not. But I think we would like to see and make sure that it is truly safe before we're administering it to not just children with CHD, but all children in general. So I would say stay tuned. We're still learning more. And hopefully as tests and trials proceed, we'll start to learn and understand more from this.
I would follow that with saying that I would encourage you all to rigorously pursue, and I know I'm speaking to the choir based on the fact that all of you are giving your time to this evening, rigorously pursue what the scientific community says. The folks that Matt works with at the CDC and the NIH, as they put forward recommendations, it is going to be based on our tried and true mechanisms to ensure safety. There will be, as you imagine, a tremendous amount of pressure to have a vaccine on the market because there's a desperation for it to be, direct. And so I would use Conquering CHD. I would use your scientific community and lean on them. I think that Matt is exactly correct that a vaccine to market is normally a longer process, not what is hoped to be an 18-month or less process. And so we are going to really have to lean on our usual mechanisms to ensure safety and effectiveness. And so, that's where I put my trust. And I would encourage you to do the same. But then at that point, when that group and that group of persons or organizations that I trust give their recommendation, then I am willing to move forward because it feels like not only the right thing for myself, but certainly the right thing for my community.
Rob, any last thoughts?
No, that was well said.
Wonderful. So we are just about at the 1 hour mark. And this is Rebecca again. I want to thank Dr. Madsen, Dr. Subramanyan, Dr. Oster for taking time away from their families to be with us this evening. It was absolutely a wonderfully informative hour. Just a reminder, this session was recorded and it will be available for viewing on conqueringchd.org, hopefully tomorrow afternoon. And for anyone needing to follow up or send additional questions, you can email us at chdwise@conqueringchd.org. Thank you so much, and we'll see you next time. Good night.
Good night.